I do trachea today on Jake. So the first thing that I'm going to do is hand hygiene. Walk into my patient's room. Hi there, Mr. Smith. My name is Anne. I'm here to do your tracheostomy care today. So I'm going to take out your inner cannula and replace it. I'm going to deep suction. I'm going to change the drain sponge around your neck there. Do you have any questions about any of this? No? Is now a good time to do it? Yes? Perfect. So now that I've gave my patient's consent and educated him, I'm just going to do my quick entrance safety check for trachs. So the first thing that I'm going to do is note the cold pot here. And so it's supposed to be set at 40% humidity, which it is, and because of that, it's supposed to be at 10 liters per minute of oxygen. So I'm going to turn it all the way up to 10 here. For the sake of video dim, I'm going to turn it off just so that you can hear me. Next thing that I'm going to do is check the suction pressure. So I'm going to take it off here. Then I'm going to turn it on and put my thumb over. And it's between 80 and 120, which is an appropriate suction level, so that's good. And next I'm just going to check for all the emergency equipment that's here. It's also just good to note that I would be wearing a mask during this procedure, but for demo purposes I'm not. So we have normal saline and sterile water, which is good. We have extra disposable inner cannulas. We have an ambu bag. We have an extra trach kit. I have a dilator here. We have a yonker if we need it. We have extra trach ties. We have all the appropriate emergency equipment. Now I'm just going to get Jake into position. So Mr. Smith, I'm just going to lift your head a bit. We'll lift the whole bed and then lift your head. So I'm just going to lift him up so that I'm not bending down, so that I'm not breaking any sterility. And I'm also just going to lift his head so that he's in a semi-Fowler's position. Okay, that's appropriate. Now, Mr. Smith, I'm just going to put the pillow here behind your back. He doesn't have any spinal injuries or anything that would contraindicate this. So I'm just going to lift him and put the pillow down a little bit lower here. Okay, that's good. So now that he's in position, I've done my entrance safety check. I can go ahead and start my trach care. So the first thing that I'm going to do is deep suction. Before I do anything, I'm going to turn the oxygen up to 100% and ask Jake to take 2 to 3 deep breaths. And this is just that he gets pre-oxygenated, because during this procedure, I'm going to be removing his oxygen. It's also just good to note that I would be monitoring his oxygen saturation during this whole procedure. Just in case anything happens, I can look at it and we'll see how he's tolerating the procedure. So because he has taken his 2 to 3 deep breaths, I'm just going to remove his oxygen here. Okay, I'm just going to put it down here so it's accessible. And so I'm going to deep suction now. So I'm just noting that Jake's trach size is size 7. So because of that, I'm going to do the -2 × 2 algorithm. So I have a 10 French suction catheter that I'm using here to deep suction for him. Now I'm just going to make sure that I'm sterilely attaching the suction to the thing. I'm just going to pick this up later. So I'm going to grab here, and again, I'm just going to check the suction pressure, so it's still between 80 and 120, so that's appropriate. I'm also just noting that I'm not going to touch the last 5 inches of the suction, because that's the part that needs to remain sterile as it's going into my patient's airway. So now that I've done that, I'm going to go ahead and insert it, and I'm just making sure that I'm not touching the outside here. I'm just going to put it all the way down, as far as possible. And now that I've hit the bifurcation, I'm going to intermittently suction and lift it up. It's also just good to note that I wasn't suctioning on the way down, as that could cause trauma to the area. So now I'm going to put his oxygen back on just for now so that he can have it on. I'm going to turn off the suction here. I'm going to wrap this in my glove and dispose of it accordingly. Also, I would actually just turn the suction back on for a second and put the end of my suction into the sterile water just so that I can drain all the mucus out of it. And I've done that, so that's good. So now I'm going to put a new clean glove on the end of it and just hang it back up. Okay, so now that I've done that, I'm just going to leave Jake's oxygen on for now, and I'm going to set up my dressing tray. So again, hand hygiene. Just making sure to only touch within the 1-inch border. just going to dispose of this drape here as I don't need it. And Jake, is it okay if I just put the garbage down here for now? He said yes. I'm just going to put my gloves over here so they don't accidentally touch my field. I'm just going to try to make sure the normal saline doesn't drip. Okay, so now that I've done that, I'm going to put on another pair of clean gloves and I'm going to remove Jake's inner cannula there. So I'm just going to make sure I have his new one ready to go before I do that, so that I can quickly put the new one in. So again, it's the same color and size as his previous one, so it's appropriate. I'm just going to open it over here and leave it by the side while I remove his old one. Okay, so again, I'm going to pre-oxygenate, so turn it back up to 100%, get him to take 2 to 3 deep breaths. He has done that, so I'm going to remove his oxygen. And just while stabilizing the flange, I'm going to remove his old inner cannula. And I would dispose of this with my gloves. And then I'm going to hand hygiene again, put on a new pair of clean gloves. And then for the new inner cannula, I'm just going to be very careful to only touch the outer ring of it, just because everything else needs to remain sterile as it is going into my patient's airway. So I'm just only touching the very end of it there, not any part that's going to enter the airway. Now I'm just going to carefully put it in. It is clicked in place, so I know that it's in. And since that was just a sterile procedure, my gloves are still clean. I'm also just going to remove the old drain sponge with these gloves and then dispose of them. And so again, hand hygiene. Now I'm going to put on a new pair of clean gloves and clean his trach. Also, just while I'm cleaning, it's good to note that I am assessing as well. So I'm just noting that the stoma looks good, the skin doesn't look irritated, there's no erythema. Doesn't look like the student's been irritated by sputum. And so his site looks healthy and he has no complaints about it. So now the first thing that I'm going to do is clean right by the stoma. So I'm just going to get my Q-tip wet with normal saline, and I'm going to clean under right flush with the stoma. And then I'm going to clean another one right above the stoma, just being careful to gently manipulate the flange. And then just to thoroughly clean, I'm just going to do one a little bit further under the flange. And then another one a little bit higher. And now I'm just to cover a little bit more surface area, I'm going to do 1 2x2 on the top and 1 2x2 on the bottom. So I'm just making sure that these maintain within the 1-inch border, and they have. So I'm just going to do one big swipe along the bottom. One swipe on the top here.
Discard this and get a new one from my cleaner, so it's going to get me a new one.
Now I'm just going to dry under the stoma here, so I'm going to do one swipe under. And then another swipe over, just making sure to do one swipe for drying, and then I'm going to dry on top and bottom with a 2x2 as well. Okay, so I'm going to dry along the bottom. And I'm going to dry along the top with one swipe there. So now that I've clean, dried, and assessed it, I can put my new drain sponge in. I'm just going to carefully open this package, making sure to butterfly so I don't contaminate it. So I'm going to carefully guide it under the stoma, and I'm just making sure that I'm not touching the inner portion with any part that would be unsterile, like my hands, but I can touch the outer portion of the flange with my hands here and of the drain sponge. Okay.
So we're gonna try it. So first thing we're gonna do is clean the chest.
So now that I've got it through here, I'm going to do the other side. So again, I'm just making sure that the inside portion remains sterile and I can touch the outside portion of the drain sponge with my hands.
Now we're ready for drying.
Okay, so now that I have the new drain sponge in there, I'm going to make sure that I return the oxygen right away.
So since it is a bigger cloth, we can cover more area.
Okay, so I have the oxygen back on and I'm going to return it to the normal and appropriate 10 liters per minute with a 40% cold pot, as that is what it's typically set at. I'm going to remove my gloves, hand hygiene again. Make sure that he's comfortable. It's also just good to know that the trach ties have been changed and the cuff pressure has already been checked, so I don't have to do that. I'm just gonna put him back down to the lowest position possible. And then he would like his head to stay up, and I'm going to put the pillow back comfortably under his head. Other than that, do you have any questions at all, Mr. Smith? No, he says okay, so all the equipment is back to normal. Oxygen is on, oxygen is back on him. There's no obvious equipment issues. So we've done all this trach here. He doesn't have any questions. He's comfortable. I'm going to make sure his call bell is within reach. Again, bed is in the lowest position possible. I'm going to leave the room, document the procedure. The equipment that I used, he tolerated it well, that the stoma site looks healthy, and that everything has been returned to previous normal settings. And then I would obviously clean up my equipment, and I'm done.